Well, those are the top stories that we are tracking. I'm Shereen Bhan. Let's go to the big story tonight. If the latest data points are anything to go by, the COVID trajectory in India could be on a downward slide. The nation's tally has risen by around 49,000 to about 80.9 lakh. That's the number in the last 24 hours. But active cases continue to decline, and they have been declining now for the 27th day in a row, slipping below the 6 lakh mark. Over 10.77 crore people have already been tested. Around 11 lakh 64,000 people have been tested in the last 24 hours. So what explains this downward slide? Earlier this week, renowned epidemiologist Dr. Jayaprakash Mulyal, in an exclusive interview with me, said that signs of herd immunity was perhaps the only plausible explanation behind the fall in active COVID cases. On the other hand, A. Velumani, the founder and MD of Thyrocare, has alleged that authorities in certain districts in certain states were trying to control the testing process in order to show a better scorecard. Meanwhile, a latest ICMR study has highlighted that the BCG vaccine, primarily used to protect against tuberculosis, can enhance both adaptive immunity in elderly people. The study, however, is yet to be peer-reviewed. Well, to get a sense of what is happening on the ground, joining me on the program, Dr. Sandeep Devan, the Director and HOD of Critical Care at Fortis Memorial. Also with us, Dr. Sandeep Budiraja, the Group Medical Director of Max Healthcare. And joining us is Dr. Satyanarayanan Mysore, Head of Department and Pulmonology Consultant at Manipal Hospitals. Doctors, thanks very much for joining us here on CNBC TV 18. Dr. Budiraja, let me start by asking you about what you make of the declining trend. For the 27th day in a row, we have seen active cases decline. What do you make of this?
Well, going by the trends, that's definitely a very positive trend. And in fact, in that respect, India seems to be behaving quite differently from rest of the countries in Europe and US, etc. But again, if you see in India, there are regional variations. For country, the figures may be going down. But if you see the figures in Delhi NCR, the graph is actually the other way around. It touched its minimum 3-4 weeks back. And now, again, it's on the rise. Now, whether to call this a continuation of the second peak or it's a third wave, very difficult to say. But clearly what we are seeing is patients coming from adjoining states to Delhi has reduced significantly. So that means the caseload elsewhere has gone down. But probably we will see an upsurge happening in bigger cities, especially in North India, because of the festive season. That's exactly what happened in Mumbai with the Ganesh Chaturthi and all. And I think that's exactly what we are seeing in NCR. So we still have to have our guards on. We should not really start rejoicing with the falling numbers and need to have the social distancing and masking clearly maintained.
Yes, this is not the time to get complacent, but let me ask you, Dr. Sandeep Devan, on how you explain this decline in active cases. To Dr. Budiraja's point that, that we are in the midst of the festive season, we are in the midst of the most aggressive unlock. Even schools and colleges have now, in some parts of the country, been allowed to reopen. Cinema halls are open in the National Capital Region, for instance. How do you then explain the decline in active cases? I go back to my interview with the epidemiologist, Dr. Jayaprakash Mulyal. He believes that this indicates a certain development of natural immunity, which is now providing the shield.
Well, I agree with this hypothesis that, see, we have tested around 11 crore Indians, as you had shown the data. So we actually tested almost 10% of the population. We are 130 crores. So when you have tested 10% of the population, a lot of the population, and this testing has mainly happened in I would say the peak 40-50 cities of the country. If you look at the other areas of the country, that's usually untested and uncalled for. Okay, so right now, as we are testing today, is only a minuscule portion of the general population at large. Point number one. So that's why maybe the disease is declining in those areas where we are testing, but maybe it's on the rise in those areas where testing is still not available. That's point number one. Second, yes, wherever we have tested and wherever the awareness levels have gone up tremendously, the herd immunity will be coming into play. I'm not, and I agree with Dr. Budiraja, it's not about the whole country, but if you look at pockets of the country, the herd immunity is coming into play. Look at the Maharashtra, the ICU, the patients are coming less. In Haryana, the patients are less. Delhi is showing the other way around. So there are pockets where it is increasing also. So it's not one theory which fits all, but I have these two opinions which I think
Yes, so we are seeing these regional variations. And on the point of testing, let me bring in Dr. Mysore into the conversation as well. Dr. Mysore, this is a point that was made by A. Velumani here on the program, the founder of ThyroCare, suggesting that in some states there is a hesitation to test and there is also a hesitation to report even if tests have been done. So the data may not be going back to the ICMR. Now, this is a claim that he has made. But even if you look at what the test numbers look like, there are some states or some regions where the test is disproportionately higher than others. Delhi, for instance, significantly higher than other cities or other states. Yes, there is a significant portion of antigen tests that are being deployed, but also RT-PCR, but the number, absolute number, is significantly higher. So how do you attribute, or what do you attribute this decline in active cases to, and what are you seeing on the ground?
The unwritten rule of any pandemic till date over the centuries is as the cases surge to a peak, the number of cases, newer cases or incidents will come down. Mechanism, is it herd immunity? It could be. Even the neutralizing antibodies have not been shown to, absolutely shown to confer immunity. Is it the other way around? Is there an innate response that develops? Nobody knows. Not yet proven. Testing, on the matter of testing, I was part of deliberations of the Karnataka government through the Vice Chancellor's office. I think for a country of this population, like Dr. Diwan mentioned, I think targeted testing should be the way to go. There is absolutely doesn't make sense spending resources on testing a 130 crore population. So you need to identify population risk, prioritize people who need to get tested, and test. Otherwise, there are chances that inappropriate use of resources in the testing quarter. South Korea has probably spent more than any other country on this earth on testing alone. Of course, their rates are low, but even a resource-rich country like US has not been able to, test at will or at random.
Sure. Even though in India we can do on-demand testing, that of course has been allowed by most state governments as well. But as Dr. Mysore is pointing out, targeted testing will perhaps be the appropriate response from here on. But Dr. Buddhiraja, let me ask you what the situation is like as far as hospitals are concerned, because we've also got a large population that has tested positive but perhaps is still in home isolation or home quarantine. Has the pressure on hospital infrastructure eased up significantly? What is the situation in general wards? What's the situation in ICUs? And if you could also share with us what the picture in Delhi is looking like, because in Delhi, we've recorded the highest spike yesterday at over 5,500 cases.
So, Shereen, I'll first talk about Delhi NCR. We clearly saw a dip in the occupancy happening about 4 weeks back, middle of last month, where the occupancy in the wards had come down to 50 to 60%. I'm talking about the COVID wards. ICU in major hospitals were still above 80% occupancy even at that time. However, the situation now and increasingly getting worse in the last 1 week in NCR. The situation is again what it was at peak of September and maybe a peak of early September. And it's probably even worse. The numbers presently stand at greater numbers in the hospitals than the early September. And that's worrisome. ICUs are literally full. We are having a challenge of catering to ICU needs of the patients who require high-flow oxygen, non-invasive ventilation, etc. But you are at the same time right in pointing out that a large number of patients are still being successfully managed in your home isolation, and home quarantine protocols are in place. So that is taking off a lot of burden off the hospitals. It's only the severe cases which are coming to hospitals. The trend which we were seeing earlier in the month or two back, that a lot of patients from outside of Delhi were coming in when the Delhi numbers per se were going down, that sort of reversed. Majority of patients presently in Delhi hospitals are from Delhi. So that clearly means that there's been an upsurge of cases. probably because of loosening of the, slacking of the norms and people sort of coming, not wearing the masks and social distancing, etc., not happening. So one has to be very careful in coming P4, and plus onset of winters and pollution is also putting people at a higher risk.
Yes. Yes. Yes, absolutely. AQI is deteriorating by the day. Plus, we've got the onset of the winters. That, coupled with the festive surge that we are seeing, doesn't bode well. Dr. Divan, if I could ask you, what is the feedback that you're getting from your hospitals, not just in the Delhi NCR region, but across the country, in terms of occupancy, in terms of ICU capacity?
So, our ICUs, particularly in Gurgaon and other areas, but in the Punjab and other, are now at 50 to 60% occupancy, though the cases have gone down. Out of our 3 ICUs that we cater to COVID patients, 1 is completely empty and two other ICUs are at 78%. So that's the case has definitely come down. In Delhi, as Dr. Sandeep was telling, the situation is different. Now, we were getting more calls from outside the Gurgaon patients for COVID care, which has completely died down now. But now we are getting calls from Delhi patients for beds in Gurgaon and other NCR areas. So that's the trend that we are also seeing. But at this point of time, we have ample capacity of COVID beds which are vacant in our hospitals. So particularly outside Delhi.
Ample capacity. That's good to hear. Outside of Delhi, ample capacity, both in the general COVID wards as well as the ICUs. So that's good news that's coming in from Dr. Sandeep Devan of Fortis. But Dr. Mysore, if I could ask you now to explain to us what you make of the trials that the WHO has done on the efficacy of the use of Remdesivir, the ICMR saying that plasma doesn't necessarily work, it's not particularly beneficial. Now, on the ground, you are the doctors who are treating patients. What do you make of what the trials are suggesting? What is working currently with patients?
Correct. So from our standpoint, I am in the process of looking at more than 2,000 patients treated here at Manipal, and looking impassionately and statistically at the data, comparing it with pre-Remdesivir days, that is before 24th of July, to after 24th of July, when the Remdesivir era started. Offhand, I can tell you that mortality substantially improved after introduction of Remdesivir. However, this is not a double-blind placebo-controlled trial. It would be a retrospective audit done in 2 different time zones. Before the drug came to Bangalore, and after the drug has been used in our hospital. Now coming to focusing on the WHO trial. WHO, as we all know, has backtracked on 6 occasions earlier. Now with the solidarity trial and the interim results of the Remdesivir, we find there are a number of points that can be debated. There is one control group which was up to 4-5 treatment arms. Therefore, there is a partial overlap of control subjects. The interim report does not talk about diagnostic confirmation of the infection in the first place. What we found in our experience, timing has to be exquisitely fine. Whether it is Remdesivir or tocilizumab, whatever you use, if you do not use it at the right time, it is not going to succeed. However, in the interim results, we don't find that they have declared the timing. Baseline physiological activity or severity score is not, found anywhere in that paper. So supportive care is also not defined. Here, the clear winner is a placebo, and in most occasions, placebo does win hands down if the trial is not designed. And there is it's not a peer-reviewed paper yet. Therefore, I would not the WHO thing unless until there is a peer review process to that. Let us look at the FDA. FDA clearly states Remdesivir is to be used, and they have put out the criteria when to use, when not to. So that is where we stand.
Okay, so you're saying that, right. So you believe that there are questions with the WHO Solidarity trial, and of course, in your assessment, which is not a double-blind trial, but the data that you've been able to assess since the 24th of July, that's pre-Remdesivir to now, which is post-Remdesivir, in your experience, with all the caveats attached, you believe that it has brought down mortality rates. But as you rightly pointed out, it also depends on the timing of the administration of the drug. But Dr. Budiraja, let me ask you about plasma, because that is what the ICMR has now decided to weigh in on, and the ICMR believes that plasma therapy is not necessarily beneficial. Now, Delhi, along with Maharashtra, was at the forefront. In fact, Max was one of the first hospitals to administer plasma therapy in treating COVID patients. What do you make of that, and what is the decision or the way forward now when it comes to administering plasma therapy?
So first of all, I'd like to say that nowhere in the world have the regulators taken a decision to withdraw therapy, may not have been a proven efficacious therapy based on one study, and more so in a treatment like plasma. So if you see world over, the trials which have happened in plasma regarding plasma therapy, there are 2 or 3 randomized controlled trials. And of course, the ICMR study was the largest prospective randomized controlled trial of about 450 patients with 240 plasma patients across 39 hospitals spread across the country. And the study was negative. It did not show any mortality benefit in people, whether plasma was given or not. The category of patients chosen was moderate severity of cases. Now, clearly, there are reports from world over where they have shown that plasma does have a protective role, especially in more severe disease. And again, depending upon the titer of the antibody in the donor plasma, the duration and the timing when the plasma was given from the time of hospitalization and the basic severity of the patient at the time in plasma. So there are a lot of variables. What I'm wanting to say is, I think India should still wait for more studies to come up. There are presently, I know of a lot of studies which are being prepared and in process of getting presented maybe in coming few weeks. Once that happens, we probably will have a much larger database to really comment whether plasma is helping our patients, especially the Indian subgroup. And if no, rather if yes, what is that subgroup of patients where plasma seems to be helping the most?
Yeah.
And we should be patient. I don't think there is too much of an adverse effects of using plasma, but at the time when the armamentarium of treatment available to physicians is limited, we should not write off a drug like that.
Write off. Okay, so don't write off plasma therapy just yet. Wait. And you're absolutely right. It isn't as if the vaccine is here or we do have a drug specific to deal with COVID at this point in time. But Dr. Divan, let me ask you about what you are now seeing with patients who have recovered, because there was this build-up of fear that patients who had recovered from COVID-19 were coming back to hospitals with complications, long haulers who were also expressing concerns about the long-term implications and the impact of COVID-19. Some hospitals have set up the OPD specifically to deal with that. What are you seeing on the ground when it comes to patients who have recovered from COVID-19 or have tested negative eventually?
So let me tell you, majority of the patients recover completely. So they just follow up with us for 2 to 3 weeks, and then they don't come back to us because they are fully fit. Minor population does come back to us with not complications, but resurgence of fever. And when we scan the lungs, we still find that there's some element of inflammation which is still present. And we just advise them that in case the inflammation is not increasing, a short dose of steroids we just give them, and then they are okay. That's point number 2. What I want to highlight is that 3 months before, we used to believe that a lot of these patients end up with permanent damage to the lung in the form of fibrosis. What we are coming to learn now that a lot of these patients whom we have now been following up for 4 or 5 months, even that damage which we used to think is a permanent damage is actually not permanent, and we are seeing happening in those areas of the lungs also. So as far as our experience shows, not many people have come back to us with complications, but yes, a minor portion does need a longer follow-up, and some have resurgence of fever. That's all.
Okay, so that's good to hear. In your experience, in your assessment in the hospitals that you're dealing with, you have been able to see that the damage on account of COVID-19 is not irreversible. So you've seen that damage being reversed in the patients that have come to you. But Dr. Mysore, let me ask you again, if you share that view there that we just heard from Dr. Divan, and also, you know, now this there are reports coming in on antibodies and how long the antibodies last, whether it's 4 or 5 months. What is your experience at this point in time, sir?
Thank you. I do agree with Dr. Divan largely. Manipal being a referral hospital, we do see post-COVID patients coming back with lots and lots of issues rather than complications. Complications are, you know, lung fibrosis, but I think Dr. Divan was quite right. Structural changes do not translate into functional disability. Just because the CT is abnormal, it does not make someone, you know, breathe inefficiently or have low saturation. That apart, you know, 1 in 300, 400 patients may have a transient decreased pumping in the heart, which actually improves on its own, and you catch 1 or 2 of the 300, and minimal intervention is required. Then we also find people do require general rehabilitation and physiotherapy, and also pulmonary rehabilitation. There are issues related to overuse of steroids, and people may require little medical help and intervention. The neurological complications we have seen are, you know, less than 0.01%. People coming in with tremors and, you know, other issues. Liver function derangement. This virus also behaves like a viral hepatitis kind of a virus, but even that is self-limiting. Most often than not, if you don't overuse medications and just assume a supportive role, this kind of gets sorted out. The most important thing is we have to remember patients either in home isolation or in wards or in ICU will have a lot of anxiety, stress, psychological issues, and they may require a little bit of counseling. And that, I think, is in excess of 70%.
Counseling.
Yes. So that is
well, doctors, you have given us reason for hope and reason for confidence, as you've heard here from 3 doctors on the panel, that what we are seeing is a decline in active cases. Of course, there are regional variations. For instance, Delhi at this point in time is seeing a spike. So this is not the time to be complacent, but there is also something to be said about the development of natural immunity, which seems to be acting as a shield at this point in time. Be careful about the overuse of medication, and of course, do consult your doctors if you feel that there is a problem, but you know, anxiety and panic is not the order of the day that is needed. Dr. Sandeep Budhiraja, Dr. Sandeep Divan, and Dr. Mysore, thanks very much for joining us here on CNBC TV 18 to take stock of COVID-19 and what we make of it today. We'll take a break. There's a lot more coming up. Don't go anywhere. We're back in a moment.